I'm Dr. Bill Lile, and I practice obstetrics and gynecology here in Florida. I'm board certified in obstetrics and gynecology. I am licensed to practice medicine in both Alabama and Florida. I've been an instructor with the University of Florida residency program and with the Florida State residency program, and I've delivered almost 4,000 babies over the past 20 years in private practice. I wanted to review how we truly treat the preborn as patients these days. How with advances in not only ultrasound but in surgical techniques, we see the preborn as a patient while on the inside of the womb. The mom is a patient and the baby is a patient, and a lot of times the mom's body will see the baby as something foreign. It sees the baby as something foreign and will actually make antibodies which can attack the baby. One example is when the mom is sensitized to a blood type. The mom will have antibodies which will cross the placenta, start to attack the baby's blood, and the baby's blood count can get really low. Well, when a baby's blood count gets low, sometimes the babies, if we don't do something, will pass away on the inside. So what do? We can actually guide a needle through the mom's belly, through the wall of the uterus, directly into the umbilical vein and the umbilical cord, and we can give the baby a blood transfusion. We can do that as early as 19 weeks gestation here at this facility. When we do that, we immediately see an improvement in the baby's condition. Sometimes we have to give the baby a blood transfusion every 3 or 4 weeks throughout the pregnancy. But we treat the preborn as patients. If we didn't, the babies would pass away on the inside. But that's just one of the simple ways that we treat the preborn as patients. We're now actually doing surgical interventions at centers around the United States, up at Children's Hospital in Philadelphia, in Boston, Texas Children's in Houston, San Francisco, Los Angeles, Cleveland. They actually will have teams. Children's Hospital of Philadelphia feels comfortable at 13 weeks gestation with their ultrasound imaging of a baby's heart to determine if they might need to do heart surgery on the baby on the inside. Children's Hospital in Boston have really been pioneering this, where they see the baby's heart, they see the condition, and they say, we can fix that on the inside. If we don't fix that on the inside, baby could pass away. One of the ways they do that is when they look at something called left hypoplastic heart syndrome, where for whatever reason, there's lots of them, the baby's heart is not pumping out enough blood from the left side of the heart to the rest of the body. Sometimes the aortic valve is too stenotic. The blood cannot flow out of that valve. So this is absolutely amazing. So what do? As early as 21 weeks gestation, which is way before a baby could survive on the outside, the best NICU. They can actually use guidance of an ultrasound, take a needle, go through the belly of the mom. They go through the mom's belly, through the wall of the uterus, and now they're in the fluid that's around the baby. They'll take that needle up to the baby's chest wall. Now, a baby's heart is only about the size of a large grape at this point. They'll take that catheter. They know the baby's valve is stenotic. They'll guide that catheter right into the aortic valve. There's a balloon on the end. They'll blow up that balloon, and within 60 seconds you can see improvement of the baby's flow around its heart. They can even place stents. They can go to the atria. The atria are the two areas on the top of the heart. And then there's a opening. Well, if that opening is not opened enough and the baby's not able to pump enough blood from the left side of the heart, they can, number one, they can put a balloon and they can open up that atrial septum with the balloon, but they can actually leave a stent in there, a little opening that will keep that open until the baby is born and it can be corrected again. But clearly, these are advances that are being done, and these are surgeries that are, heart valvuloplasty while the baby's on the inside of the womb before it could even survive on the outside. It's amazing. Spina bifida. Children's Hospital in Texas down in Houston is now looking at the babies with spina bifida as patients as well. Not the famous picture where you saw an opening made in the mom's womb and the surgery being done on the spine. They're actually taking tiny little cameras and tiny little ports, and they're taking these instruments and it can actually correct spina bifida, a defect in the baby's spine, as early as 21 weeks gestation. It's amazing. They're doing this surgery in the womb because a lot of evidence shows that the babies that have this surgery in the womb do better than the babies that have the surgery after they're born. There's another condition where twin babies don't each have their own placenta. They're sharing one placenta. Well, sometimes kids don't share nice. And these twins are not sharing the nutrition from the placenta equally. So what can happen? One baby will get really big and another baby is very small. They can actually go in and tell the babies to play nice. They can say, this is your half of the placenta, this is your half of the placenta. Well, how do they do that? They actually can go in with a camera, with a scope, right into the womb. They can look at the placenta and they can map out all the blood vessels that are on the surface of the placenta. They can take a laser and they can just go bzz, bzz, bzz. They can destroy the blood vessels that are taking too much nutrition to one baby and not enough nutrition to the other. They're dividing the placenta in two and saying, this is your half, this is your half, now play nice. Well, one of the real keys of how we're doing blood transfusions, we're doing heart surgery on the babies, valvuloplasty, septoplasty, we're treating the baby as patients on the inside. The American College of Obstetricians and Gynecologists, when it talks about informed consent, which is a process where we explain the risks, benefits, indications, and alternatives to a patient. Well, one of the keys is that ACOG says that we need to treat the patient as a person and give them that respect. Well, when is a baby in the womb a patient? Well, I would say that if we're doing heart surgery, valvuloplasty, septoplasty, we're doing spinal surgery, we're doing placental surgery, we're doing blood transfusions on the baby where we're transfusing the baby with O-negative blood that you might have given to your local Red Cross. We're doing so many interventions, saving the life of the babies on the inside that I think clearly they're a patient. And if they're clearly a patient, then they're clearly a person. In 1973, the United States Supreme Court said the word person did not apply to the preborn. Therefore, the preborn were not protected under the 14th Amendment, which says no state shall deprive any person of life, liberty, or property without due process. Well, we weren't treating the babies on the inside as patients like we do now. So clearly, they are patients on the inside with all the advances we're doing. So if they're patients on the inside, then they're persons on the inside. And if they're persons on the inside, then they deserve our protection. We treat them as patients. We need to treat them as persons, treat them with the respect and the protection that they deserve. And that's my goal as a pro-life doc. prolifedoc.org. If you have any questions, get in touch with me. I'd be happy to answer them. God bless y'all and have a great day. Bye.